I am Dr Helen Piercy. I'm a GP locum in West Lancashire. It's always been okay, even when the whole country was in lockdown, to visit your GP. What we need you to do first is phone for an appointment, and you would be assessed first of all, and then you would be invited in if you need to be seen face to face. If you're in an area of local lockdown currently, it is still okay to ring your GP for an appointment, and you will be asked to come in if you need to be seen face to face. During the peak of the pandemic, we certainly saw a drop in the number of patients requesting appointments with the GP or the nurse or the team at their surgery. I think that patients were worried about catching coronavirus, and so instead of seeking help when they might have done in normal times, they worried about the risk of contracting coronavirus and decided to sit on their symptoms. I think the other factor is that patients didn't want to burden their doctor with their symptoms at that time. If you are unwell, your GP wants to hear from you. At the practices that I work at, patients are screened for coronavirus symptoms before they are allowed to be seen in the surgery. The doors are usually locked, so the only people who come in are those who then have their temperature checked, are obviously wearing a mask at the moment, and then have their then gel their hands, and then we have a one-way system around the GP surgery. After I've seen the patient wearing full personal protective equipment, then it's my responsibility to then clean down that clinical room before I would see another patient wearing fresh PPE. I would encourage anyone who is worried about their symptoms to pick up the phone and book an appointment with the GP. There's obviously a crossover of symptoms between coronavirus, such as a cough, and symptoms that would be consistent with lung cancer. And we want you to pick up the phone and discuss your concerns with your GP, and together we will decide what happens next. Some of the symptoms of lung cancer that we are watching for are when a patient coughs up blood, or whether they have a persistent, by persistent we mean 3 weeks or more, a persistent cough, or becoming short of breath, have a hoarse voice, or are losing weight, or have chest or shoulder pain that's going on for a period of time. In those instances, we really want you to ring your GP and book an appointment. If you are unwell, your GP wants to hear from you. Pick up the phone and book an appointment.